Nova Scotia's Medical Services Insurance (MSI) program provides residents with access to medically necessary health services, such as doctor visits, hospital care, and other health services. Here's an overview of what's covered under the MSI program. Doctor services include visits to general practitioners, GPs, where MSI covers visits to family doctors or other general practitioners for health assessments, consultations, and treatment. Specialist services are also covered if referred by your family doctor, including visits to specialists like cardiologists and dermatologists. Hospital services cover inpatient care, where MSI covers the costs of hospital stays when admitted for treatment or surgery, emergency room services, and outpatient services provided by hospitals, such as diagnostic tests, outpatient surgeries, and specialist consultations. Surgical services include medically necessary surgeries that are deemed necessary, including those performed in a hospital setting or by an authorized surgeon. Maternity and prenatal care services related to prenatal and postnatal care are covered, including visits to obstetricians and gynecologists, hospital deliveries, and certain prenatal tests. Diagnostic services cover laboratory tests and X-rays, where diagnostic services such as blood tests, urine tests, and imaging like X-rays, MRIs, and ultrasounds are typically covered under MSI if they are medically necessary. Ambulance services include emergency transportation, where emergency ambulance services are covered when medically necessary, though there may be limitations on the level of coverage depending on the circumstances. Prescription drugs are not directly covered by MSI. However, residents may access other programs like the Nova Scotia PharmaCare program to assist with medication costs based on eligibility. Preventive care and screenings include vaccinations, where routine immunizations for children, adults, and high-risk groups are covered, and screening tests, where certain preventive screenings such as mammograms for breast cancer and Pap tests for cervical cancer are covered under MSI, depending on eligibility and age. Mental health services include psychiatric care, where MSI covers visits to psychiatrists and mental health services provided in hospitals or other healthcare facilities. Other services such as physiotherapy, chiropractic, and podiatry are typically not covered under MSI unless deemed medically necessary and provided in specific circumstances like hospital outpatient services. Exclusions include services such as cosmetic surgery, most dental services, over-the-counter medications, and certain specialized treatments. Private health services outside of the province may not be covered. MSI is available to all Nova Scotia residents who meet residency requirements, and coverage is generally free of charge for most eligible individuals. For more information, please visit the MSI website. Thanks for watching.